All right, so this is the nervous system prep requirements. Number one, the blank nervous system consists of the brain and the spinal cord. Number two, the peripheral nervous system consists of the blank and blank. Number three, the frontal lobe of the brain is mainly responsible for blank and blank. Now, there's a multitude of things that the frontal, occipital, all those lobes, but just give me two, or how many ever I'm asking for, that are consistent with being like the most dominant portrayals of that particular lobe. Number four, the occipital lobe of the brain is mainly responsible for blank. Number five, the peripheral lobes of the parietal lobes of the brain are mainly responsible for blank and blank. Number six, the temporal lobe is mainly responsible for blank and blank. Number seven, some right brain hemisphere functions include blank and blank. Some left brain hemisphere functions include blank and blank. Number nine, cranial nerves for vision and eye movement include blank, 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 and blank. Number 10, the cervical spine primarily relays information that deals with blank. Number 11, the vagus nerve activates the blank nervous system and blank heart rate and blood pressure. Number 12, during fight or flight, sympathetic activates the heart rate to blank as well as blood pressure. Peripheral blank also occurs, which limits blood to the blank and focuses blood to the blank organs. Number 13, the meninges cover and protect the entire blank nervous system. Number 14, the area of the brain responsible for vital signs is the blank, which is composed of three segments, the blank, blank, and blank. Number 15, increased intracranial pressure is defined as blank. Number 16, the blank on the neuron axon allows for electrical conduction, insulation, and prevention of short circuiting. Number 17, the blank junction allows for neurotransmitters to reach blank receptors, ACH right here, to allow for muscular contractions. And now the application part. Number one, in blank, autoimmune properties, autoantibodies destroy acetylcholine receptors. So what's that condition called? Number two, without acetylcholine receptors, muscle blank develops, and in severe cases, the blank system may be affected, which can lead to deadly complications. Number three, right hemisphere CVA manifests with the patient becoming blank. Think that the patient thinks he is always right. And that's just a way of you memorizing the main feature of what people with right-sided brain, right-sided CVA, how their behavior is going to be manifest. Number four, left hemisphere CVA manifests with the patient losing their blank ability. Kernig's and blank signs are indications of meningeal irritation and meningitis. Number six, patients with increased ICP should have their head of the bed placed in a and blank position. Number seven, Cushing's response manifests with blank, blank, and a widened pulse pressure. Number eight, Guillain-Barré syndrome is unique because it causes blank paralysis that may require respiratory support. Number nine, demyelination leads to weakness and abnormal sensation throughout the body in blank, blank. It also causes impaired bladder and bowel elimination. This occurs more often in women than men. Number 10, blank, a sensory disturbance precedes tonic-clonic seizures and migraine headaches. 11, blank and patent airway maintenance are of utmost importance when caring for patients having a seizure. Number 12, blank, blank, or blank will manifest secondary to CVA. Belongings will be kept on the ipsilateral side of CVA since it is the patient's unaffected side. 13, blank is the most common side effect of most anti-seizure medications. Number 14, blank are different from anticoagulants because thrombolytics blank blood clots.